Welcome back, Deep Divers. Today, we're going to be tackling a chapter all about your brain on aging.
Yeah.
We're going to be looking at all the research and theories and even some real-life examples.
Real-life examples are always good.
Yeah, they help to paint a clear picture of how your brain changes over time. This is something that affects all of us.
It does.
Yeah.
Yeah, it's a very personal topic for a lot of people.
It is.
And it's fascinating stuff.
Yeah.
We're often bombarded with these myths about aging, but the reality is your brain is constantly evolving, and while there are some natural slowdowns as we age,
Right.
there's also this incredible potential for growth and adaptation.
Yeah, and the chapter really kicks off with this myth-busting idea that the brain doesn't just stop developing at 25.
Right.
Like, that's it.
Yeah, there's this idea that after a certain age, your brain is basically set.
Right.
The reality is far more dynamic. Researchers have discovered that new neurons, the building blocks of your brain, continue to be generated in certain areas, even into late adulthood.
Wow, so where are these new neurons popping up?
Well, one key area is the hippocampus,
Okay.
which, as you may or may not know, plays a crucial role in memory formation.
Okay.
So think about it. You're constantly learning new things, forming new memories, even as you get older.
Right.
And then there's the olfactory bulb, which is involved in your sense of smell.
Interesting.
Yeah.
I wouldn't have thought that, sense of smell is linked to neurogenesis.
Yeah.
But hold on. The chapter also mentions brain shrinkage.
Yeah.
How does that fit into this whole new growth idea?
Yeah, it's true. Some shrinkage does occur, particularly in the gray matter.
Okay.
But it's important to understand that this shrinkage is selective.
Okay.
Different areas of the brain are affected at different rates.
Right.
And it doesn't necessarily equate to a decline in function.
So it's not like our brains are just deflating like old balloons or something.
Not at all. Think of it more like a remodeling project.
Okay.
As we age, some connections might become less efficient while others get strengthened.
Okay, that's a helpful analogy.
Yeah.
So our brains are constantly adapting and rewiring themselves.
Yes.
Based on our experiences.
Exactly. And this adaptability is one of the most remarkable things about the aging brain.
Okay.
For example, studies have shown that older adults often engage more areas of their brains to solve problems compared to younger adults.
Interesting.
So it's like they're tapping into a wider network of resources.
That's incredible. So it's like the brain has this backup system ready to go.
Yeah.
When needed.
Yeah, in a way.
But what about processing speed?
Yeah.
Doesn't that decline with age?
There is a natural slowing down in processing speed, yes.
Okay.
But slower isn't always a bad thing.
Okay, I'm intrigued.
Yeah.
Explain that one.
Well, sometimes a more deliberate, thoughtful approach
Right.
can actually lead to better decision-making.
Okay.
Older adults often excel at tasks that require careful consideration and weighing of options, even if they take a bit longer to get there.
So it's like the tortoise and the hare. Slow and steady wins the race, especially when it comes to these complex decisions.
Exactly. Now, all this processing, this amazing adaptability, it all starts with input, right?
Right.
How we take in information through our senses.
Okay.
And the chapter dives deep into how those sensory changes that naturally come with aging can affect how our brains process information.
So we're talking about those small, almost unnoticeable changes in our vision, our hearing, taste, touch.
Precisely. Even subtle changes in sensory input can have a ripple effect on cognitive processing.
Okay.
The brain relies on these signals from our senses to make sense of the world, and when those signals become weaker, it has to work harder to fill in the gaps.
That makes sense. If you can't hear clearly, for example, it's going to take more effort to follow a conversation.
Yeah.
And that could tax your cognitive resources.
Exactly. Now, when we talk about processing, we can't ignore memory.
Right.
It's a huge part of how our brains function.
And it's often the first thing people worry about when they think about aging. Those senior moments. Forgetting names, misplacing keys.
Right. And those moments can be frustrating. But it's important to understand that memory is a complex system with different components, and not all of them decline equally with age.
Okay, break it down for me.
All right.
What are these different types of memory?
Well, there's something called explicit memory,
Okay.
which involves conscious recall of facts and events.
Okay.
This is the type of memory we use when we try to remember a name or a date. And yes, this type of memory can become a bit less sharp with age.
So that's why those tip-of-the-tongue moments seem to happen more often as we get older.
Exactly. But here's the thing.
Okay.
There's also something called implicit memory, which involves skills and habits, things we do automatically without conscious effort.
Okay.
And this type of memory tends to remain quite strong even as we age.
So while you might forget someone's name, you can still remember how to ride a bike or play the piano.
Precisely. And then there's perspective memory, which is all about remembering to do things in the future.
Oh, like remembering to take medication or to call someone back later?
Yes, and this type of memory can become more challenging as we age. It's not that we don't care or aren't motivated,
Right.
it's that our brains might have a bit more difficulty juggling those future plans.
That's reassuring to know.
Yeah.
It's not necessarily a sign of something serious.
Right.
Just a natural shift in how our brains prioritize tasks.
Exactly.
But before we get too bogged down in what declines,
Yeah.
the chapter also highlights some good news, right?
Yes.
What about vocabulary, for instance?
Yes. This is a great example of how certain cognitive functions can actually improve with age.
Really?
Older adults often have a wider vocabulary than younger adults simply because they've had more time to learn and accumulate words.
So even though we might struggle to recall a word, sometimes our overall word bank is expanding.
Exactly. It's fascinating how certain areas of the brain can continue to grow and evolve, even as others might experience some slowdown.
This is a lot to take in, but it's really fascinating to see how much is going on beneath the surface, so to speak.
Yeah.
Now, the chapter also dives into the heavier stuff,
Yeah.
neurocognitive disorders.
Mm-hmm.
I have to admit, this is where things get a bit more complex
Yeah.
and perhaps a bit scary.
It's important to address these conditions, but it's also important to remember that they're not a normal part of aging.
Okay.
They're distinct medical conditions with their own unique causes and progressions.
So what's the first thing the chapter emphasizes about these disorders?
That not every forgotten name or missed appointment is a sign of something serious.
Okay.
There's a distinction between typical age-related changes and what's known as mild cognitive impairment,
Right.
or MCI.
So MCI is like a gray area
Yeah.
between normal aging and a more serious condition.
Yes, with MCI, someone might experience more frequent forgetfulness or have difficulty with certain cognitive tasks,
Right.
but it's not severe enough to significantly interfere with their daily life.
But MCI can sometimes progress to a more serious neurocognitive disorder, right?
That's a possibility, but it's important to remember that not everyone with MCI goes on to develop dementia.
Right.
In fact, many people with MCI stay stable or even improve over time,
Wow.
especially if they address potential contributing factors like sleep stress or medication side effects.
That's good to hear. So what about the more serious neurocognitive disorders? The chapter mentions that there are actually many different types.
Yes, and it's crucial to understand that these conditions are not simply a part of normal aging.
Right.
They are distinct disorders with their own causes and characteristics. The most well-known, of course, is Alzheimer's disease.
Right. Alzheimer's is the one we hear about the most.
It is.
The chapter goes into quite a bit of detail about it.
It is the most common cause of major neurocognitive disorder, characterized by a gradual decline in memory, thinking, and reasoning skills.
Okay.
One of the hallmarks of Alzheimer's is the buildup of amyloid plaques and tau tangles in the brain,
Right.
which disrupt communication between brain cells.
So it's not just about forgetting things.
No.
It's a progressive deterioration of brain function.
Right.
The chapter also talks about vascular disease, which sounds like it's related to blood flow in the brain.
Yes, vascular disease, sometimes called vascular dementia, occurs when there's damage to the blood vessels in the brain, often due to a series of small strokes or mini strokes.
Okay.
This can lead to cognitive decline, but the pattern of decline can be quite different from Alzheimer's.
So while both conditions can cause cognitive impairment,
Yes.
they manifest in different ways.
Exactly. With Alzheimer's, you often see a gradual, steady decline.
Okay.
With vascular dementia, the decline can be more step-like with periods of stability or even slight improvement, punctuated by sudden drops in function following a stroke.
It's fascinating and a bit scary to see how different conditions can affect the brain in such distinct ways.
And it highlights the importance of a thorough evaluation if someone is experiencing cognitive changes. Accurately diagnosing the underlying cause is crucial for determining the best course of treatment and support.
Yeah, the chapter also mentions a couple of other less common but equally important disorders like frontotemporal disorders and Lewy body disease. Can you tell us a bit more about those?
Certainly, frontotemporal disorders, as the name suggests, primarily affect the frontal and temporal lobes of the brain, which are involved in personality, behavior, and language.
Okay.
Unlike Alzheimer's, where memory loss is often the first symptom, frontotemporal disorders can manifest in changes in personality, behavior, and language abilities. Someone might become more impulsive, socially inappropriate, or have difficulty finding words.
So it's not just about cognitive decline. It's about a fundamental shift in who the person is.
Exactly, and this can be incredibly challenging for both the individual and their loved ones.
And Lewy body dementia, what sets that one apart?
Lewy body dementia is characterized by the buildup of abnormal protein deposits called Lewy bodies in the brain. These deposits can disrupt brain function, leading to a wide range of symptoms, including cognitive decline, movement problems, visual hallucinations, and fluctuations in alertness.
Wow, that sounds incredibly complex to manage.
Yeah, it can be.
So with all these different neurocognitive disorders,
Yeah.
how accurate are diagnoses,
Yeah.
especially in the early stages?
That's a crucial question, and unfortunately, misdiagnosis is still a significant problem.
Right.
The symptoms of different disorders can overlap, and sometimes what appears to be a neurocognitive disorder is actually something else entirely.
Like what that chapter mentions, some reversible conditions that can mimic dementia, right?
Right. There's a whole range of conditions that can cause cognitive impairment that might initially be mistaken for a neurocognitive disorder.
Okay.
Depression, for example, can lead to memory problems and difficulty concentrating.
Hmm.
Malnutrition can also significantly impact brain function, as can thyroid disorders, vitamin deficiencies, and even certain medications.
So it's like a detective story trying to piece together all the clues
It is.
to determine the true underlying cause of someone's symptoms.
Exactly, and that's why it's so crucial to have a comprehensive evaluation by a qualified healthcare professional if any concerns arise.
Okay.
It's about ruling out those reversible conditions and ensuring that people receive the appropriate treatment and support.
This has been a whirlwind tour of the aging brain, covering everything from neurogenesis
Yeah,
to the complexities of neurocognitive disorders.
we've just scratched the surface.
Yeah.
There's so much more to explore. In the next part of our deep dive, we'll delve into the lifestyle factors that can influence brain health,
Okay,
both positively and negatively,
right.
and discuss strategies for maintaining cognitive function as we age. Stay tuned.
Okay, I can't wait.
Picking up where we left off, let's explore those lifestyle factors that can actually make a difference in how your brain ages. Because while some changes are inevitable, there's a lot we can do to protect and even enhance our cognitive function as we get older.
This is what I'm talking about. Give us the actionable insights. What can we actually do to keep our brains sharp?
Well, research consistently points to a few key areas that have a huge impact. And the great news is that these are things within our control.
All right, hit me with the first one.
At the top of the list is physical exercise. You might think of exercise as something that primarily benefits your body,
Right.
but it has a profound impact on your brain as well.
Okay, but how does working out translate to brain benefits?
When you engage in physical activity, especially aerobic exercise, your heart pumps harder, increasing blood flow throughout your body, including your brain. This increased blood flow delivers more oxygen and nutrients to your brain cells,
Okay.
which is essential for their health and function.
So it's like giving your brain a direct nutrient boost.
Exactly. But it goes beyond just fuel. Exercise also stimulates the release of a protein called brain-derived neurotrophic factor, or BDNF.
BDNF.
Think of BDNF as a kind of fertilizer for your brain cells.
Okay.
It promotes the growth of new neurons, strengthens existing connections, and even helps protect brain cells from damage.
Wow, so exercise is actually changing the physical structure of our brains.
That's right. And that's what we mean by neuroplasticity, the brain's ability to adapt and change throughout life.
Right.
Exercise is one of the most powerful ways to tap into that neuroplasticity and keep your brain agile.
So hitting the gym is like hitting the refresh button on our brains. I like it. What's the next big factor we can control?
Next up is diet. What you eat doesn't just affect your body, it directly impacts your brain health as well.
So we're talking about more than just avoiding those late-night donut runs.
Definitely. A diet rich in fruits, vegetables, and whole grains provides your brain with the essential nutrients it needs to function optimally.
Okay.
We're talking about antioxidants that combat oxidative stress, omega-3 fatty acids that support brain cell structure, and a whole host of vitamins and minerals that are crucial for brain metabolism and signaling.
Okay, that makes sense. But what about all those fancy brain-boosting supplements I keep seeing advertised?
Oh, yeah.
Do those actually live up to the hype?
While there are some supplements that show promise,
Right.
the research is still evolving.
Okay.
The best and most sustainable approach is to focus on getting those brain-boosting nutrients from whole foods.
Okay.
It's about creating a balanced and diverse dietary pattern that supports your overall health, including your brain health.
So it's back to the basics. Real food over quick fixes.
Yeah.
Okay, get behind that. What's the third pillar of brain health we should be focusing on?
This one might be the most enjoyable: social engagement. Staying socially connected is not only good for your emotional well-being,
Yeah.
but it also has a direct impact on your cognitive function.
Wait, so just hanging out with friends and family can actually make me smarter?
Not exactly smarter, but it can definitely help keep your brain sharp.
Okay.
Social interaction involves a whole range of cognitive processes, from language and memory to attention and emotional regulation.
Okay.
It challenges your brain to stay engaged and adaptable. Plus, it helps reduce stress and loneliness, both of which can have negative impacts on brain health.
I guess those years of debating philosophy with my friends weren't a waste of time after all. But seriously, it makes sense that stimulating conversations and social interaction would be like a workout for the brain.
It's exactly that. It helps maintain those neural connections and even promotes the growth of new ones.
Yeah.
Remember, the brain thrives on novelty and challenge, and social engagement provides both in abundance.
So staying curious and connected is key. Now, before we move on, I wanted to circle back to those reversible conditions that can sometimes be mistaken for neurocognitive disorders. The chapter highlighted a few that I think are worth unpacking a bit more.
Absolutely. It's so important to be aware of these conditions
Right.
because early detection and intervention can make a world of difference.
Let's start with depression. The
Well-
chapter mentions that it's often misdiagnosed as dementia,
Yeah.
especially in older adults. Why is that?
Depression, particularly in later life, can present with symptoms that mimic cognitive decline.
Okay.
People might experience memory problems, difficulty concentrating, fatigue, and a general slowing of thought processes.
So someone might seem forgetful or withdrawn, and it's assumed to be dementia when it's actually depression.
Exactly. And this highlights the critical importance of a thorough assessment.
Right.
Healthcare providers need to consider all potential factors, including mood, medical history, and medications before jumping to conclusions.
That makes sense. Treating the depression can often alleviate those cognitive symptoms. Another one the chapter brought up was malnutrition. How does that affect the brain?
The brain, like every other organ in your body, relies on a steady supply of nutrients to function properly. When those nutrients are lacking, cognitive function can suffer.
So we're not just talking about feeling hungry. It's about getting those specific vitamins and minerals that our brains need.
Precisely as we age, our bodies might not absorb nutrients as efficiently.
Okay.
And certain medical conditions or medications can interfere with nutrient absorption. This can lead to deficiencies that directly impact brain health. For example, a deficiency in vitamin B12 can lead to confusion, memory problems, and even neurological damage.
That's concerning.
Yeah.
So what can we do to prevent these deficiencies?
A balanced diet rich in a variety of fruits, vegetables, and whole grains is the best foundation.
Okay.
In some cases, supplements might be recommended to address specific deficiencies,
Right.
but it's always best to consult with a healthcare provider to determine individual needs.
The chapter also discussed something called polypharmacy,
Yeah.
which sounds a bit intimidating. What exactly is that?
Polypharmacy refers to the use of multiple medications, which is unfortunately quite common,
Yeah.
especially among older adults who might be managing multiple chronic conditions.
So what's the problem with taking multiple medications?
The more medications someone takes, the higher the risk of side effects and interactions.
Okay.
And some of these side effects can directly impact cognitive function.
Right.
For example, certain medications used to treat anxiety or insomnia can cause drowsiness, confusion, and memory problems.
So it's not just about the medications themselves, but the potential for them to interact with each other and create a cascade of side effects.
Exactly. And this highlights the importance of having open and honest conversations with your healthcare provider about all the medications you're taking, both prescription and over the counter.
Right.
It's about finding the right balance between managing medical conditions and minimizing the risk of unintended cognitive consequences.
This is all so important for understanding the bigger picture of brain health. It's not just about one thing. It's about a complex interplay of factors.
You've hit the nail on the head. It's a holistic approach that considers physical health, mental well-being, lifestyle choices, and even social connections.
Yeah.
It's about recognizing that brain health is an integral part of overall health and well-being.
This has been a fantastic exploration of the things we can control when it comes to brain health. But I'm also eager to delve into some of the potential upsides of aging.
Yes, let's shift gears a bit and explore those cognitive gains that can actually emerge in later life.
All right, so welcome back to our deep dive into the aging brain.
Yeah,
We've covered a lot of ground,
we have.
from the cellular changes that occur to the lifestyle factors
Yeah.
that can impact our cognitive health.
Absolutely.
But before we wrap up, I'm really curious to explore these cognitive gains you mentioned earlier.
Yeah.
Those potential upsides of aging.
Right.
that don't always get the attention they deserve.
Absolutely. It's not all doom and gloom when it comes to the aging brain.
Yeah.
There are some incredible strengths and abilities that often emerge in later life, things we might not even think about when we consider getting older.
Okay, I'm all ears.
Yeah.
Let's talk about those cognitive gains. What are some of the things that actually get better with age?
Well, for starters, there's creativity. It might seem counterintuitive,
Yeah.
but research suggests that creativity can actually peak in later life for many people.
That's fascinating. Why do you think that is?
There are a few theories at play.
Okay.
One idea is that as we age, we become less inhibited, more willing to experiment and take creative risks.
Interesting.
We've accumulated a lifetime of knowledge and experiences,
Right.
and we're less concerned with what other people think. This allows us to tap into a deeper well of inspiration and express ourselves more freely.
So it's like we've earned the right to break the rules
Yeah.
and explore new creative territory.
Exactly. And think about all those societal pressures and expectations that might have constrained our creativity in earlier years.
Right.
Those pressures often diminish as we age,
Okay.
freeing us up to pursue our passions and express ourselves authentically.
I love that idea, aging as a time of creative liberation. The chapter also mentions something called a life review as a potential cognitive gain. What exactly is that?
A life review is essentially a process of reflecting on our lives,
Okay.
revisiting key events, relationships, and decisions.
Okay.
It's about making sense of our experiences and finding meaning in the stories we've lived.
So it's like taking stock of our life journeys and trying to piece together the puzzle.
Exactly, and it's not just about reminiscing. Research has shown that engaging in a life review can have a profound impact on well-being.
Oh, wow.
It can help us resolve past conflicts, come to terms with regrets, and even strengthen relationships.
That makes sense. By reflecting on our past, we can gain a deeper understanding of ourselves and our place in the world. And the chapter suggests that this process can actually lead to cognitive growth.
It can. The process of retrieving memories, analyzing events, and finding patterns in our lives
Right.
engages a whole range of cognitive functions, from memory and language to emotional processing and self-awareness.
Okay.
It's like a mental workout that helps keep those neural pathways active and engaged.
That's incredible.
Yeah.
So simply reflecting on our lives can be a form of brain training. I'm definitely going to have to try that. Now, the final cognitive gain the chapter explores is wisdom.
Yeah,
It's something I think we all aspire to.
we do.
But what exactly is wisdom, and does it really increase with age?
Wisdom is a complex concept, and there's no single definition that everyone agrees on.
Okay.
But it's often described as a combination of knowledge, experience, and good judgment.
Okay.
It's the ability to see things from multiple perspectives, to understand human nature, and to make sound decisions, even in challenging situations.
So is it true that older adults are wiser simply by virtue of being older?
While there's a popular belief that wisdom comes with age, research suggests it's not quite that straightforward.
Okay.
It's not like we automatically become wise once we hit a certain age.
So what's the key ingredient? If it's not just about accumulating years, what makes someone wise?
It seems that wisdom is more about how we've lived those years,
Right.
the experiences we've had, and the lessons we've learned along the way.
Okay.
People who've faced adversity, made mistakes, and learned from those experiences often demonstrate greater wisdom than those who've led more sheltered lives.
So it's about navigating life's ups and downs,
Yeah.
gaining perspective, and developing empathy and compassion for others.
Exactly. It's about integrating our experiences,
Okay.
both positive and negative, into a deeper understanding of ourselves and the world around us.
Right.
And that's something that takes time, reflection, and a willingness to learn and grow throughout our lives.
This has been such an eye-opening exploration of the aging brain.
Yeah, it's fascinating.
We've debunked myths, explored the complexities of cognitive changes, and discovered that there's incredible potential for growth and adaptation throughout life.
Yeah, it really is a lifelong journey.
So as we wrap up this deep dive,
Yeah.
what's the one message you want listeners to take away?
Embrace the journey. Your brain is a remarkable organ, constantly evolving and adapting. Challenge it, nourish it, and stay curious. And remember, aging is not a destination.
Yeah.
It's a lifelong adventure of discovery.
Beautifully said.
Yeah.
Thanks for joining us on this fascinating exploration of the aging brain. Until next time, keep those minds sharp,
Keep them sharp.
those hearts open, and those spirits adventurous.